Hi everybody, my name is Amanda Esparza. I am a registered nurse and I graduated back in 2010, so I have a few years of nursing experience behind me. Today I wanted to talk to you all about heart disease, well not specifically heart disease, but some resources you can reference for getting care related to heart disease. I know a lot of you are between the ages of 40 and 65. A lot of you can relate to me just because we're both Hispanic. We both kind of are from the same area. I currently work at Foundation, so it's pretty close to your area and the George Dieter, Pelicano, I guess, east side of El Paso. And the following things that I'm going to be addressing with you are basically some resources that are available to you to treat you. Well, I guess places that can treat you for the illnesses that you may currently have. And as I mentioned, the big one is heart disease. So I just want to start off by presenting a little flyer that I made for everybody. And so this flyer is right here. I don't know if everybody can see it, but it says healthcare clinics. And there are two. Okay, this is one up here. This is one down here. Okay. And so the healthcare clinics that I will be talking about are Project Vida and San Vicente Health Clinic. So Project Vida has several things they offer for patients, and so I'm going to briefly go over those and then go over how they would care for patients with heart disease as well. Okay, and so their mission is basically at Project Vida. Their mission is basically to identify the vision for the community and its future, and develop community-based structures and programs that the community can utilize and need, and that they may need. They usually they usually treat the underserved population and the uninsured. Okay, so that's a really good thing about that place. They are located on 14900 Greg Drive, Suite B. And that's in the 79938 area of El Paso. So that's far east. Let's see. And so some of the things that they offer are primary care, women's health, pediatrics. They even offer psychiatry. And for you all, they would offer nutritional classes and yoga classes. Okay. And so as far as primary care, I've had the pleasure of speaking with the nurse practitioner Magdalena there. She's very well-informed, well-educated, and very nice lady. And so as far as primary care, they do see a lot of patients, as I mentioned, with heart disease, also with diabetes. And we all know that patients with heart disease, most of them anyway, about 70% of Hispanic women with heart disease are also overweight. And a lot of that has to do with their diet. And so, as I mentioned before, they do offer classes, and the classes are awesome. I had the pleasure of seeing the kitchen area where they prep the food and where they cook, and it's a pretty nice area. And I also had the pleasure of meeting one of the, I believe she calls herself a promotora, which is like a promoter of health and fitness, and so she also teaches yoga classes. And so that's pretty sweet that she does that. So the other clinic, as I mentioned, was San Vicente. So San Vicente is a little bit closer to your area. That is located in the 79915 area, in pretty much the Lower Valley east side of El Paso. And so that location also offers primary care, women's health, pediatrics. They have a pharmacy. So it makes it a lot easier for those patients to be able to get their medications in a more timely manner, and not really have any issues with having to go back and forth, clarify orders or anything between providers. And so their they do give or administer antihypertensives, cholesterol-lowering medications, things like that as well. And they also actually have an X-ray department, not really a radiology because they don't have any other like MRI or CT, anything like that, but basic X-ray. They also have dental, and they also have nutritional classes. Now, for both these places, the nutritional classes are offered for family, and just because they like to incorporate the whole family dynamics into the teaching, since it's really important. And let's see, why should people in my population access these resources? And what are the strengths of these resources? So, as I mentioned before, the strengths are that they basically cater to low-income families. Of course, if you have insurance, that's even better. I mean, anybody would love to have insurance. But if you don't, they do go based off of income. So it's very affordable, and it's not that expensive. And so that's a very, very, very big bonus. Pretty much everybody in there that works there, they do it because they love it. You know, they don't get paid $1 million or anything to be there. And they do this because they actually genuinely love their job. And so the environment, it's a great feel overall. And the providers are awesome and amazing. And it says, who would the people need to contact? So who would you all need to contact for the resources? So for these resources, I did on this flyer, there is a number on here for Project Vida, and then down here there's also a number for San Vicente. You can contact that number, and basically they can transfer you to the registrar's office, and there they're going to let you know what documents you need to present to them when you go. And usually it's something like a pay stub or a bill, just to make sure, obviously, that you're part of our community, and that you can give a small payment. And even if you can't, they'll work with you if you don't have a job or whatnot. And as far as access to these resources, as I mentioned before, the closest one to your area would probably be San Vicente. And that's just because it's as I mentioned, it's closer. You would need, obviously, transportation. It's not in walking distance at all by any means. But you could use Sun Metro, the public transportation. You can use an Uber. I don't think it would be that expensive to take, just because it's pretty close. The other location with Project Vida, that one is pretty far from your community, and that one you would not be able to walk. So they do have also Sun Metro going to that area, just because it's actually really close to a high school. I believe it's Mountain View, if I'm not mistaken. But they do. I have seen bus stops around that area. And then as they welcome children, so they're not, constrictive on that. You're not going to have to leave your kids at home. You can take them. And of course, if you work during the day, it may be hard to be there during working hours. I know for a fact San Vicente is open till 7 in the evening, so you can possibly schedule an appointment after work or walk in even to be seen. As Project Vida is a little bit more restrictive, so they don't have that available. And then as far as the benefits of actually using the resources, so they have so many things that they offer other than primary care. As I mentioned, women's health, it's very important to get your screenings. Pediatrics for your children to be seen. Psychiatry, Project Vida is the only one that offers a psychiatry. And let's face it, health overall can be a daunting thing. And so usually things contribute to our health, such as depression, anxiety. Some people turn to food for comfort, and it's not all the time that they turn to healthy foods. So that can be an issue. And obviously, as I mentioned, they have yoga and exercise class, so that can help relieve some of the stress and relieve heart issues. For those who are seeing this flyer, you can see these websites on here. They also are very helpful. The websites I left on there are for www.heart.org, and that's for the American Heart Association, and www.cdc.gov, and that is also for heart health. And on those two sites, there are English and Spanish pamphlets and brochures and informational things on heart disease, how to prevent it, what to do, questions that you may have as far as pathophysiology or how the disease starts, and any questions you can reference regarding medications or pathophysiology, and treatment or management of those heart issues. But my time has come to an end, so thank you so much for your time. Have a good day.